I'm thrilled to be with all of you, including folks who weren't there last week. We'll be glad to be with you now and again in January, hopefully. Um, I think the hope for this next little bit of time is we got some lovely questions from folks who were there last week. So we're gonna kick off, I think, with that, right, Kevin? Does that sound good to you?
Yeah, and welcome more if
Yeah.
people want to add
Yeah,
them. Yeah.
please keep them coming.
Uh,
And
I did set up, I think in the settings that there's a Q&A option. So in the menu, people can find maybe a way to that way, or even just in the chat, or you can email them to me directly and I can.
well, and we have a small group, so we welcome people unmuting and just
yeah,
jumping in.
yeah, absolutely.
We'd love to have a conversation with you rather than talk at you. Um,
Yeah.
yeah.
I think the other piece I'll mention, just so folks have this in your at least the side of your mind for the next couple bits of this conversation is Kevin and I have talked a bit since last week about this group and kind of directionality. And so one of the things you just mentioned, Megan, that I always find really important is to remember how to make things practical for people. Because sometimes we talk about all these big things, right? Like that, economic insecurity underpins 90% of child protection. Okay, and what do we do about that? And so one of the ways I think we'll try to make sense of that, or at least plant the seeds today in a practical approach, is something called power threat meaning framework. And we'll talk about kind of how that fits into the some of our, I think, unlearning of our current mental health system is how I'll put it. But it's just a really practical way. So I wanted to just tune people's ears into that particular language as we go. I think it'll be really helpful. Yeah. So I'm going to just read these. Is that okay, Kevin?
Hmm.
Yeah. So the first one, I think LA County came up last week.
Yeah. Yeah.
So what are the steps to reaching the same rate of kin first placements as those mentioned in LA County?
Yeah. Um, th- I'll talk practically in a moment, but I'll frame uh, this in I think an important way that reflects our learning from one community to another. So not just LA, but when we look at LA and other communities and how they've done next to one another, there's a common thread. And so, and by the way, we can put a link if you'd like more about that, Liz. Maybe we could put the link of Judge Nash and I. So Judge Nash and I did a presentation for the Kemp conference in October. It's a global child protection conference, and he and I did one of the keynotes together. Judge Nash is the direct is he's the leader at the Office of the Director of Child Protection, which is a separate office from the Department of Children and Family Services in LA County. So there was a murder of a child. I think I could be getting this wrong, Liz. Do you think it might have been uh, what was his? Was it 2016 maybe, or
Who are
was
you
it?
talking about? Gabriel?
Yeah, maybe 2011.
I think it was earlier
Yeah.
than
So you may know because it was ended up being terribly depicted in a 2013, terribly depicted in a Netflix series that's really hard to watch. I don't recommend it. But he was murdered by his mother and her boyfriend, and there was a blue ribbon commission established to look at that particular murder and make recommendations. One of those recommendations was to create a separate office from the Department of Children and Family Services, specifically called the Office of Child Protection. And the former presiding judge in LA County for 30 years, Mike Nash, was appointed to that office. And Judge Nash and I had worked together beginning in 2003 on the research, early parts of the research of my family finding, learning. And so by the time he gets appointed to lead that office, one of the initiatives that he wants to enact is is to implement a family finding approach that is different from what we had done previously, and that was instead of looking at the longest waiting and most complex needs young people in Los Angeles County to go, sometimes more than a decade later and re-engage their families into planning with them. His idea was to do it right at the knock on the door, right at investigation. And so he did what he initially called upfront family finding. Today, they've changed the name back to family finding because of the funding streams in California. But the upfront describes something very important, which is the family engagement work begins right at the knock of the door. Anytime there's a likelihood that a young person is going to be separated from their parent and not be able to be placed and will not be able to live with that parent. And so the as you heard, the long and short of it is that LA County has 19 offices, and today the average kinship rate in LA County within 60 days of knocking on families' doors is 80%. Um, some of the offices are considerably higher. That some are at 95%. One in January was at 100%. It varies depending on the office, depending on the month, but it's extraordinarily high. And the um, the first thing I'll say about what has happened in LA County, and I would give the key to this is leadership, and that's really the point of the Liz put the link to the webinar with Judge Nash and myself. The key to the success in the county, firstly, is leadership and what we in a kin first implementation. This has been written about by the American Bar Association. It's also been written about by Annie E. Casey and others. The first lesson in a kin first implementation is that it requires senior leaders of systems like child protection, I would argue, mental health, probation, um, I hope schools, public health, to make a commitment to the idea that for children that cannot live safely with their parents, they that we should make intensive efforts so that their first placement away from their parent is, here's the language, very simple, is with someone they know and that knows them.
Mhm.
And that in the science is this concept called buffering. It's this notion that we were just talking about before the recording started about why do we think that the longitudinal health outcomes for children involved with child welfare agencies that we looked at last week. And maybe, Liz, we should put the link to the research in the chat for folks who weren't there so you can take a look at it. Um, why is it that children who stay with their parents in child protection interventions had their present prevalence of living with an incurable chronic, or what we call a chronic disease, which means an incurable disease by age 49 was about, Liz, what was it? Was it about 13%?
I think so.
Okay. And which is about, as I mentioned earlier, about what we'd expect to see in people that had an ACEs score of 4. So they look the same as people with, and for an ACEs score of 4 is considered to be an elevated score. So when we look at the ACEs research as epidemiological data, not individual assessment, and we look at population health outcomes, we can see that for people with an elevated score, we see uh, that they experience a chronic disease in adulthood at about a rate of about 12 to 13%. When you look at the kids who encounter child welfare agencies and for some reason were able to stay with their parent or go to their other parent, they as a group look about the same. If you encounter children in child welfare investigations and remove them from their parents and place them into kinship care. By the time they're 49 years old, 50, I believe 50, let's see, uh, by the time they're 49 years old, 43% of them have. Oh, I see. It's 13%. By the way, going back to parents, 13% at 10 years after leaving their parents' care, effectively adulthood, defined by age 18. And then at 30 years after, which is age 49 roughly, they've got a 21% chance of living with at least one incurable condition. If they went to their grandparents by 10 years after leaving kinship care, their rate of chronic disease reporting is 21%. And by age 49, they report having chronic disease at a rate of 43%. Well, what that means is that 57% of them are not living with their chronic disease by age 49. That's not as nearly as good as as the people who stayed with their parents. But if we look now at foster care and residential care, both are considerably better. Kids who even spend one day in a foster home or one day in a residential setting, by 10 years after leaving the care system, 4 out of 10 of them reported living with at least one chronic condition. And by the time they were 49, it was 85%. It was nearly 9 out of 10 were living with at least one chronic physical health condition or mental health condition, behavioral health condition.
Can I
Many, in all likelihood, lived with what we call multimorbidities, which is three or more. So a combination of physical health problems, behavioral health problems, mental health problems that were considered severe and chronic. So that's the science of refreshing on that. What's different? We think one thing, there are two things that are different. One is the simplest one is probably buffering. And what that means is that there's something profoundly intrinsic to the well-being of children to to have and to be in relationship with their parent, or parents. Um, we're not clear that they necessarily have to live with them to benefit from that relationship, but the relationship is important and can be highly protective of their development, even though they and their parent might face hardship. I mentioned last week, during the last federal administration, I was involved in on behalf of three women that had their children taken at the border in litigation in California in the federal court against the administration for harming their children by forcibly separating them from their parents at the border. We were able to successfully navigate that litigation, and the administration settled the lawsuit with the parents, and it was certified as a class action suit. And what we were showing was the the deliberate separation of young children from their parent because they crossed the border presumably seeking um, some kind of protection in the United States from things that were happening in their home country. Um, that deliberate separation, we were able to show, especially when it was extended, disrupted severely the developing brains and bodies of those children. And for many of those kids, it would mean, as some of you heard from Jack Schoenkoff in the video I played, it would mean that they would have a lifetime of consequences as a result of this, especially those who had extended separations from their parent. It is, if you can accept that thinking that we showed with the science in the federal lawsuit, if you can accept that idea that that separation that removing the protective nature of the relationship between the parent and the child. Now, when I say protective, I mean simply the relationship. Remember, these are families that are unhoused, facing incredible uncertainty, that have, if you recognize that story, may have taken months-long journeys of really severe hardships to get from their home country to cross into the United States. There were arguably all kinds of traumatic experiences, all kinds of distresses associated with that journey. But the presence of that relationship between the parent and the child is recognized as being protective of some of those hardships on those kids. Now, my point of telling you that story is if you can connect that science to not that narrative, but the foster care system and child protection and children's mental health and probation systems, we can see that there might very well be hardships, particularly neglect present in the lives of the majority of kids that are separated by the child welfare system and get involved with the juvenile justice system. And where we've historically done some separating of them from their parents, whether we separate them to put them in foster care, and we call this child protection, or whether we separate them in response to a juvenile crime. That separation, even though there may be hardship in that family, is means that child is going to lose the protective nature of that inherent relationship between the child and their parent. And and what you can see in the data that we just showed you is what happens longitudinally in terms of the what we call the life course health trajectories of those people related to that separation, and that gets to the second part, which is there's the separation from the parent and the loss of that protective relationship. And then the second part of it, which is more complex and relates back to the adverse childhood experiences studies. Now, remember, when we think about that, we tend to think about that science when it was created in the mid 1990s. But remember, there's been decades of continuing research around those ideas. And so, as we understand and think about the adverse childhood um, experiences study and its subsequent and the subsequent learning beyond the original authors, what we learn about child development is that development is affected by an interaction between not just the number of adversities or what we call cumulative adversities, but the composition matters a great deal. The composition matters. You can't just think about the number of adversities. You have to look at the composition. And let me say that the composition of adversities, I will add in a surprising way, matters for better or for worse. In other words, um, protective factors, positive childhood experiences, what are called PCEs, the presence of these protective, inherent relationships in kinship and culture, particularly with parents and siblings, can do a lot to buffer. Otherwise, the way that these hardships would disrupt the development in children. So, the composition of adversities matters in a really significant way, we've learned. Um, So it's both things. It's the how many adversities and what is the composition of the particular circumstances and adversities that people live in allow us to predict fairly well. When we know what the adversities were and we understand the composition of adversities, we can be fairly good at making predictions into the future about what it might mean for this person's health and mental health. What that allows us to do then is tell the difference between a young person and family where an intervention might be really important and one where it wouldn't matter very much. What I mean by wouldn't matter very much is there's enough strength and protective factors in the family, even though they live with some hardships, that without intervention, it probably won't cause much harm to this person's future health. The classic example of this would be poverty and neglect, and what we call simple neglect with young children. If you have a parent or parents and a young child, and they're living with in the context of what we call the social and political determinants of health, housing insecurity, um, nutritional insecurity, uh, violence in the neighborhood, maybe separated parents, and they're affected by this, and um, they the child experiences this, but they stay with their parent, and it happens in for a relatively brief period of time, typically I think defined as about what we call two critical periods of development, not more than two. Um, that child, we think when we look at them as a population, as adults, their health doesn't look much different than people who didn't have that experience. So there's no reason to be doing separations of children because of poverty and simple neglect that's episodic. So if you're a child protection investigator, you need to pay attention to that when you go out and do your assessment. You need to understand something about simple neglect. You need to understand more in a more detailed way how child development actually works and understand something about subcritical and critical periods of development. Look at the age of people and how many buffering, how's the buffering going for them? Because what it would tell you is even though I could make an argument for neglect and petition the court to do a separation here, there would be really no reason to do that because the long-term outcomes for this person in this group are not likely to be detrimental. In fact, the intervention might be worse than what's happening to this kid, and I need to understand that. Now, if I on the other end of it, if I go out and I meet a young female child, genders do matter somewhat in the outcome data, who's a young child living in poverty, and they've been sexually abused, the there probably is a need for an intervention aside from the fact that we're pretty responsive and outraged by sexual abuse. We know that those girls are much more likely to have reproductive health problems and other behavioral health problems in adolescence and adulthood than kids who didn't have that particular combination. So it's the combination of the distress of the social determinants and the experience of sexual abuse together that produce a particular set of health and behavioral health outcomes in adolescence and adulthood for them that require a response now because we can help in that situation with particular interventions that could prevent severe reproductive health problems and other kinds of psychological distress problems with those people by the time they're adolescents and young adults if we didn't do an intervention at all. So in that case, we want to respond. For boys who are growing up in poverty and witness violence in their family, that's a particular um, again, a particular cumulative set of adversities and a particular composition, witnessing and living around family violence. What do we know about those boys? We know that they're about 12 times more likely to become involved with the justice system as young men. There's an argument where we see boys growing up in poverty who are experiencing or witnessing family violence to be doing an intervention with that family because we want to do what we can do in support of the family to reduce the vulnerabilities to that young person to becoming themselves involved with the justice system through antisocial and violent behavior in adolescence and young adulthood. So those are two examples. Um, this is about it's we're changing what we're arguing for is changing the complexity that we use in trying to understand what has happened to people and what it might mean in the future as a way to organize how we use public resources and how much we get involved or we don't get involved voluntarily or involuntarily with families in our communities. That's where we want to be these days in terms of thinking about social policy and about how we organize responses. We don't want to just be thinking, by the way, about this kind of information because you're a child protection professional. We need to be thinking about this and understanding it if you're a pediatric mental health provider, if you're a pediatrician, if you're a general practitioner, if you're a school teacher, if you're a school counselor, if you're a psychologist in the community or a therapist. We need an in common understanding of the science. We need an in common understanding of the language that we use to make sense of it. And we need to be talking to each other as system partners and approaching families in a complementary way and taking advantage of this incredible revolution in genomics and biological science and neuroscience that's happened in the last 30 years. Unfortunately, our systems run about 20 to 30 years behind that science. The simple message here, in terms of improving how systems operate in a community or a state, the first opportunity for improving is collaboration. And the second is very simply been put, as I mentioned last week from David Sanders at Casey, we need to close the gap between what we do and what we know. How would our practice look if we were to take advantage of this remarkable revolution in learning over the last 30 years and apply it in an in common way across systems in our communities that are intended to be helpful to people rather than disruptive to people's lives? Um, so the context in Los Angeles is that it's not just that they've learned the importance and learned how to place more children with their relatives or with their other parent or restore them to their parent. It's why they do it that matters. Why? Why do you do that? And does everybody understand why this is important in terms of changing? And then there's the how you do it. And the how, I'll just finish quickly, is in their context, that turns out to be, I think, particularly important in a California context versus other states, is one of the things that California did that other states have not done as a result of the KDA lawsuit, is they've held on to their investment in wraparound, in individualized and child individualized and care, and particularly the idea of child and family team meetings. So what LA County has done is not only invested in infrastructure and leadership around prioritizing kin placements for children who can't be with their parent, they have also made a substantial investment in certifying county staff, particularly in as facilitators. So they have a three-level facilitation certification available to county employees that comes with added pay and added respect. And so there's a first level, which is becoming basically knowledgeable as a facilitator. There's a second level, which is becoming a skilled practitioner in how to facilitate child and family team meetings. And the third level is a level of certification that you can teach others how to do these things. And they created within their structure, their HR system, and their payroll system, a way to reward that level of skill appropriately as people rise and give people increasing levels of authority as they rise up in their level of skill when it comes to leading child and family team meetings. So you get an intersection of two things happening here. One is you're keeping kids in the context of those protective buffering relationships from the beginning. And secondly, there is a child and family team construct so that you're not just focusing on where children are living, but you're paying attention to how families are supported and by whom.
Mhm.
That's a really important way of understanding what they've done. That's, I think, at this point unique in California. We see other counties with who like Santa. I'm sorry. I'm blocking. Which county is it? In the what's Santa Cruz County, for example, that's done pretty well on their kinship numbers. and I would say has some similarities to LA. But and so we do see other examples of counties that are doing fairly well. But I think LA is the only county that's done this particular design, which is that child and family team meeting component is an unseen part of how are changing the mindsets of county employees who've been there for a long time and also creating an environment of practice that starts people off in the right way when they're new to the organization. So I'll stop there. Thank you.
I think some of the last bits of that fit with the other. I think there's actually a few questions that
Yeah.
navigate into this, which is right. You're talking about how many systems fit together, and I think one that we sometimes don't think about is the sort of economics pieces of this. And
Yeah.
so the
Yeah.
question I've seen at least twice in this document and once in the chat, I'm going to read the first question. What are some successful upstream strategies in remote economic housing addiction challenged communities to eliminate downstream charities? In other words,
Yeah.
right?
That comes out of me showing the Cambodian Children's Trust video, I think.
Yeah.
Um, and I think we'll talk here for a minute just and point you towards Claire Anderson at Chapin Hall.
Mhm.
Liz, do you have the
I do.
slide deck? We'll put
Yeah.
that in the as a resource in the chat for you also. Um, but we, what, and this will move us toward the power threat meaning material. The the problem we have in our legacy systems, helping systems, particularly since 1980, with the advent of the DSM-3 and then subsequently the 4TR, the 5 and the 5TR, is it teaches us, and it has really actually acculturated in our society the belief that people are problems,
Yeah.
and that problems that people experience exist in their bodies and brains and their genes. So it suggests that where we encounter in the context of thinking about children, pediatrics, where we encounter children in distress associated with hardships in their families, whether that's through the school system or public health or again, child protection in the most severe forms, mental health, juvenile justice. The way the workforce is taught to think because of the problems that happened in our development of the American mental health model is we tend to think that there's a biological or biomedical reason for this, and we have names for this, right? We call it um, autism spectrum disorder. We can call it oppositional defiant disorder. We can call it depression. We can call it ADHD. We can call it sort of their usual suspects you'll recognize for diagnostic terms. Because the problem with that idea, remember I said we want to welcome the complexity rather than simplistic explanations. A simplistic explanation is to look at a distressed family and a distressed child and send them to a clinician to be diagnosed within the DSM and then say, I get it, this kid has autism spectrum disorder. That ignores the larger social, economic, political context of the family's experience, even before the child was even conceived, and the experiences of their parents, and how the environment of experiences and relationships that children grow up in and are even conceived in there's a more accurate way to think about this, which is that these children and their parents are in fact responding to the environment. They're response able. We say they're response able. They have a response to what's happening. You would think that I'm talking cognitively and behaviorally. I'm actually talking about the super system, the way that our bodies read and the way through the what we call the epigenome, the above the gene structures, and the incredible sensitivity humans have to their environment and their relationships and their sense of fairness, their sense of autonomy, their sense of agency. Um, that there's a biological response to this that partially is explained by what we call child development, but it doesn't stop with child development. We continue to have responses to our environment across our life course, including aged people. Um, but that's a more accurate way of understanding the complexity of how humans respond to experience. But what we've done is we've taught the workforce and we've taught policymakers that instead it's something called oppositional defiant disorder. It's something called ADHD. It's an unclear combination of mental health problems that requires treatment by, in the most extreme conditions, by a drug cocktail commonly with their most complex needs young people. That really is not true. That way of thinking is not helpful. It promotes problems because it suggests that people are problems and systems are solutions. The truth of it is people are solutions and they experience problems. And why is that important to know the difference? Because it tells you where you need to be standing in relationship to them. People have problems that they are responding to. How do you want to position yourselves in relationship to them? Is a very different way to think and a different way to organize support and a different way to think about how institutions in a democracy operate. I'll give you a quick quote and then I'll give it back to Liz and stop rambling. I meant to bring this up last week, but I talked several times last week about um, Vince Folletti, who was one of the co-authors of the Adverse Childhood Studies, and some of his quotes. For those of you who missed one that I think is really interesting to think about has to do with addiction. And Folletti says addiction is a terrible public health crisis in America. Truth. But there's a second truth, he says. It is a terrible public health crisis for America and the American people. It may be a solution for the individual. That's what he said. What does Ondas say? Goes in another direction about children. Ondas says this. He says the theory of change of our welfare state, I'm paraphrasing here, implemented just after World War II, this refers to the story I told about the Beveridge report, is a theory of change that comes out of in the post-war period, um, influenced by Beveridge's design of the welfare state, that says that governments exist to solve social problems. So we organize institutions beginning after the war, and then it takes another leap in the middle 1960s with the Johnson administration with the war on poverty programs around this idea that stays with us from the end of the war that governments exist to solve social problems. We we see very quickly within 15 years of the end of the war and the implementation of those ideas that our welfare systems are already failing. If you're anyone sitting close to my age, I'm 60. There's no time in my living memory where the welfare system in the public was not being criticized as failing and needing reform. How about in your life? And Onda's making an observation that the theory of change, the idea that governments exist to solve social problems, is proven wrong in the adverse childhood experiences study. That's his big takeaway. That failed. For children, it fails. Instead, Ondas says very plainly, parents and grandparents are the agents of change in the lives of children. That's the theory of change, and government should exist to help them be that. To be clear, he's saying that they're the agents of change in the lives of children. What he didn't say, but I think intended, is for better or for worse. From a child development standpoint, those relationships, particularly parents and grandparents, shape the futures. of young people, for better or for worse. And that a society that cares about health and cares about the future outcomes of its children have to commit to helping parents and grandparents to be able to be the kind of agents of change in the lives of their children that would set them on a course for good health, good well-being, and success in their society. That's just the fundamental truth of it. And it's what we have is a system that says instead, social service agencies, government programs are the sources of solutions for kids in distress. We don't have any evidence that that has ever worked. It's never worked because it's inconsistent with the biology of stress in humans, and it's particularly inconsistent with what we know now to a molecular level about child development, not just brain development, but the whole super system and its interactions. It's a super system. It is not just the early days of child development thinking was as though they were as a brain walking around on stick on kind of, as a brain on a little stick figure. That's just fails. We know that it is a whole body experience in the context of relationships within the family, within the community, and within the society. All of this shapes, for better or for worse, what happens. Nobody is a more important mediator of those outcomes than parents and grandparents are in the lives of kids.
So to that last
Yeah.
point, Kevin,
Yeah.
follow-up question. Can school and care providers legally talk to family kin when there's a care situation? How do you navigate the legal or confidential aspects if you can't get children and family services on board? How can
The
grandparents
most
and couples be more?
this the, through if you should be able to diagnose your own problem here. If the parents won't aren't in a partnership with you such that and in and also they themselves in somewhere in a process of reconciling their relationships with their own family and community, the problem is they're not giving you permission. The problem is you don't have a relationship with them. The permission is not the problem. We don't argue that we should go forward and talk to the relatives without the permission of parents. It's the fact that you don't have permission from parents to talk to people is the problem you need to pay attention to because it says something about the relationship between you and the parent. Um, we now, when it comes to child protection, and this was not necessarily my intention when I did the research, when it comes to child protection, we're in a unique position from other systems. And that is because of the family finding legislation that got in the Fostering Connections bill in 2008. Talking to relatives is not something we might do. Talking to relatives is something we are required to do, whether the parent wants it or not, because we have a mandate from the federal government that it's supervised by local or California state courts. So the court has oversight. The judicial branch has oversight into whether or not the agency is complying with federal law. And federal law says that we have 30 days to not only be in communication with the relatives and kin, but to be expansively searching for and identifying those relatives and kin. So the fact is, in child welfare, it's not a question about whether you can talk to the relatives. You're required to talk to the relatives, and you have 30 days to begin to do it, or to do it actually. It doesn't mean you can't talk to them later. It just means they want you to give that notification within those first 30 days. So child protection's in a unique position. I prefer to think about the practice from a mental health standpoint, where there are very strict protections in place around healthcare privacy, and where I'm required to get people's consent before I share anything that might be personal protected healthcare information under HIPAA. I prefer that standard of practice because I'm seeking a relationship of being in support of parents and in support of the family and children, not to be using some kind of authority I might have under the statute, whether the family wants it or not. So the best practice is consent. And to get consent means that you have to have some kind of relationship of trust between yourself and parents and yourself and grandparents and others. And that's what you should be working for.
I'm thinking also I don't know if this came up at all last week, but I'm thinking that one of the conversations that I've been having a lot this particular last month is around the idea of alignment. So a really practical, we even have tools for aligning, or sometimes in the context of families and professionals together, we would describe it also as blending of perspective. But the conversation that I've been having with lots of folks is that we sometimes, when we're thinking about or talking about all of these things, we skip that step. And it's a really important step, if you will. I always cringe a little when I say step because I don't want to imply that this is step by step. And if you learn the steps, it'll be perfect. But when I'm saying skip this step, what I'm talking about is sometimes the first conversation we have to have is not about the problem, the solutions, the safety plan, any of that. It's about how do we get aligned? Do we have a similar view of what's happening, but more importantly, what each of us might do to stand in the place to do the most good, to be positioned to help, but also recognize capabilities or resources. And so an alignment conversation where I used to work in Philadelphia County as a good example would include, okay, who are other professionals involved? And then immediately, who's the family? Who's the network? Can we have an alignment conversation with those folks? Including sometimes really difficult alignment conversations. I'll give a really practical example that I find helpful. We're in a room together in a family network meeting or conversation or gathering. I don't always call them meetings. And A to Z, A, absolutely, Z, zero possibility. Everybody go around the room and say where you are about your hope or your belief that this child can go home. And let's deal with that very directly. That's an alignment activity. If I'm an A, absolutely, as the family finding caseworker, and the GAL, the guardian ad litem, is a Z, zero chance, we've got an alignment problem first and foremost. You could do the same thing with the person wrote this privately, so I don't want to put you on the spot. But the person who asked that question to Kevin, you could do the same thing, couldn't you? Parent doesn't want so and so at the meeting. Like, let's do some alignment around that. What's going on there? Get underneath of that with people.
And can I shift that list just to add,
Please.
I'm not terribly interested in who the parent doesn't want at the meeting.
Yeah.
I'm interested in who the parent does want at the meeting. I'm not in the position to define for the parent who's important and who has been important to them as they have been going through whatever they have been going through.
Yeah.
We're too often quick to see where the conflict is rather than see where the opportunity is. The opportunity is to start where parents want to start, not to tell parents where to start. Remember, we're not just talking about child welfare here. We're talking about juvenile justice. We're talking about the education system, public health, mental health. The only system you have, well, I guess the juvenile justice could do it with a court order. Um, but the only system you have that may have the authority under federal law to impose this that I know about is the child welfare system. Otherwise, everyone else needs to get really good at working um, with people seeking um, their informed consent, because that's where you are.
If I may jump in,
Yeah.
Liz and Kevin, I'm thinking about this from a systems perspective, as especially in California, as we're expanding into CalAIM services and that Medi-Cal and that community health worker, like using this framework to understand positioning, like understanding positioning where this community health worker is in this person's life, and then engaging this kind of conversation around like who else needs to be at the table, and kind of having that wraparound conversation. But I'm just trying to think about like I'm currently chairing the Healthy Mendocino Collaborative, which is a voluntarily submitted collaborative of a lot of different professionals who are really doing good. But
Yep.
I think having that perspective of like what position I'm in, I'm just trying to unpack the concept of what you're providing here and how to really put those into practice with a variety of different professionals and getting to there's a philosophy of like, what was that like, right? Getting into that philosophy of asking the person who's receiving services, what is it like for you? What do you need? Is that kind of like, I'm trying to help our collective here too, to find some tactile things that we can like walk away and apply elsewhere out of this Zoom meeting and the 2 days that we had last week. So we can have some tactile kind of like hand philosophies or models to like move the needle forward because the agencies that have the power in our county aren't in this Zoom. We are working in this peripheral kind of pressure thing. So it's like, I don't want to work harder. I want to work smarter and how we engage the professionals that we do have daily contact in and helping align this perspective shift that I think that we're all
Yeah.
kind of unpacking together. Does that make
Yeah.
sense?
So, because I can see the muddle that we're presenting you with. I get it. The the mixing of talking and beginning to lean towards practice informed content versus, you know, talking about, as we would say about working with families, something well, you've heard it your whole life. We want to meet people where they're at. We also want to meet communities where they're at. This is really probably not a time to talk about the practices. They're to come together and try to understand the why, the why of it, right? So the you know, I I trust and I think you will trust your partners in if we use the word alignment, you will trust your partners to align. I'll say it a different way. This was a lesson I had from a mentor in my life about conflict in the organization. And I was in an organizational leadership position, and and I was young, and he was trying to teach me something. And he was talking about conflict with other professionals. And he said, when you're in conflict with another organization or individual, maybe one of the first things you need to think about is if they knew what I know, surely we would see things the same way. So, in other words, my job is not to win an argument with another group. My job, if there's a misunderstanding, is to do a better job of communicating what I think I know. Um, so the fundamental idea here is what we call a shared language, and where what we ask is anyone involved in serving in a health context or a social welfare context or even a justice context, that it's important to start your conversation at what can we agree is fundamentally true? What are our fundamental truths? And we sometimes call this bedrock science or consensus science, but where do we have a consensus worldview about what we think is true that we can share in common as we think about how we want to organize in this community and how we want to do things. And so the first step is to bring people together with the commitment that we're going to spend some time trying to explore together and maybe separately and then coming back together to discuss can we agree is fundamentally true. Um, for example, we're being fairly provocative by being critical of the American mental health system. Now, that might sound like, an anti-psychiatry kind of perspective that Kevin and Liz at Pale Blue have. That's not the case. We are reacting to, in fact, two reports from the World Health Organization and the United Nations. The last one was October 9th of 2023, which was the eve of the 23 World Mental Health Day, where the both global bodies were telling their member organizations that they should stop medicalizing psychological distress, that there was no evidence to continue to support it. They used some very catchy language. They called it the medicalization of an unlivable life. And the UN criticism for its members, which include the United States, was that public leaders had used the American mental health model, aside from its quality of evidence, to effectively situate responsibility for social inequalities in the bodies and brains of people experiencing those inequalities and calling them diseases. And what that did for policymakers and government member governments was it prevented them from being seen as responsible for the social conditions that their citizens live in. And so the recommendation from the UN and the WHO was there's no science to support this underlying idea. We should stop using it, and our members need to start taking responsibility for and confronting their responsibilities from as policymakers to create laws and to enforce laws that that protect people's health and protect people's well-being from being harmed by unequal and unjust policies. That's the message from the UN and the WHO. In the last four World Mental Health Days, two of them were devoted to this topic, including most recently in October 9th of 2023. Um, so we need to have a combat conversation about how do we do this. I want to go back though to your bringing up the the was it Cal Works or Cal Aim? I forgot you said it, but
The CalAIM initiative.
Cal Aim, right? Okay. So what I like about the direction of Cal Aim and the thinking about Medicaid is the first opportunity is to begin to think about the problems we collectively face as health problems, not bad people problems. These are health problems, and they're predictable. The the behavioral health problems that we see, some of which do lead to child abuse, which is real. Children can be really harmed, which will then probably require a policing response, are in fact health problems. And they also may lead to policing problems. But the policing response is not a solution, it's a response. We need to look at health. And we need to understand that when we look at health, that health is not useful to view health through a lens of health care or healthcare systems. Health is political. Health is social, not a healthcare response. They're separate. We can shape public health, particularly improve public health over time by paying attention to children's experiences. It's why a child development and child focus is so critically important because we're not just talking about kids ready to learn, we're talking about people with the health to live. In the future, it matters. And if you're paying attention to the health needs of children, you're forced to pay attention to the health needs of parents and grandparents. And we need to think about the problems we're facing and confront them through a health perspective, which is political and social first. We can then talk about how our healthcare and mental health care systems may be responsive to these political and social problems. But what we can't do is look at the health system as somehow the place where we're going to fix these things. There's no evidence for that. There's no evidence that these systems are good about fixing social and political problems. But they're convenient when we look at them that way because they're not unlike what I said earlier about the WHO and the UN's publishing about some of it. The extreme version of it says that we need to abolish the American mental health system as it exists in other countries, and this one. That's pretty extreme, but that's what they've said. But the but when we look at the health system, we need to look at there's kind of two conflicting truths. One, that health systems don't solve political and social problems in a society. They can't do that. So don't look at them to do that. But the second thing is they can make it worse. They can themselves be biased. They can themselves. We can see strong evidence that in our healthcare system that African American families are substantially disadvantaged. Native American families have the worst health outcomes of any group, not that it's a contest, and that Hispanics and Latinx families also have poor outcomes, although they do better than the other two groups. There are disadvantages that all of them face compared to white privileged folks when we look at how our health system operates. So health systems can make bias in a system worse, but they can't fix bias in a system other than their own. They can be at the table with other partners collectively, working with policymakers and working on what we do. And again, what's uncomfortable here, and we're uncomfortable because we don't do it, we try to be apolitical, is the first start of the conversation is a recognition that human health is a political and social undertaking, is not a healthcare system undertaking. And that is a hard conversation to have across systems in a community or in a state or in a nation. But it's a conversation that we're called to. What is the evidence that supports that? The political and social determinants of health science is really well understood. And it's very clear that differences in health trajectories are shaped by social and political drivers, not by people, not by genes, not by things that exist inside people's bodies, but by the things people's bodies respond to in the societies where they live. And that is never more true than when we're talking about kids. So that framing matters because what it informs you about, whatever system you're associated with or private organization you're associated with, or if you're a citizen activist, it gives you a way of making sense differently of what's going on, which then informs the thing Liz said earlier. Am I standing in the place where I or my organization can do the most good? And the truth is, if you were, you'd know it because you'd be standing with parents and you'd be standing with grandparents and you'd be standing with young people.
Mm-hmm.
You'd be standing with teachers. You'd be standing with public health nurses. You'd be standing with therapists. You'd be standing with social workers together. And you'd be working together for a kind of policy-making experience that makes sense rather than perpetuating the system we've got. And I realize that's way too political, but that's just where the science takes you. It's where we know this at this point. We know it. Um, what's LA? How does LA County's work fit in this? It doesn't solve it, um, but it is it is not insignificant that the largest child protection jurisdiction on planet Earth has effectively ended the idea of a foster care system and said instead they're going to organize around keeping families together. Um, and more than just paying attention to the addresses that kids are living at, what is the support around those children? What is support around their caregivers? And that gets to economics. It gets to is it's it wouldn't for and we see this some places in California, um, Santa Clara County being an example. Um, they're more likely to put money in a parent's bank account who doesn't have money in their bank account. They're more likely to put money reliably in the bank of account of a teenager, uh, a, a, a young person transitioning to adulthood. They're more likely to get money in their bank account and make sure they have housing and make sure they have the basics of life so that they can have the ability to focus on education. They can focus on their relationships in the community. That's just smart. That makes more sense than not doing that and paying five social workers and a justice worker to chase that kid around. It's just a smarter move, and quite frankly, it's economically smarter. There's 60 years of research to show that direct cash transfers and material supports create bigger impacts on improving the safety and well-being of kids than any social work model that we've ever had. but we don't want to talk about it. So we put in the chat that science. You can look at Claire's 200 slide deck to look at 60 years of science that make that point. How is it possible we have 60 years of science, but we don't do this very much? It has nothing to do with what's true. It has to do with what's political. We have the evidence. You heard, and I'm writing an article right now. Liz and I are writing an article right now. I'm working on my bit and giving it back. I'll read it to you. The title, I keep changing it. Today's version, The False Gods of Change, Industry Authored Policy and Evidence-Based Models as the Rocket Fuel of Reform. What is that really saying? It's saying that the real issue is power. Um, we have a belief system operating still, driven by social welfare and other industries, that if they had more money, if they are seen as the only legitimate authors of policy, they are seen as the only legitimate authors of evidence-based interventions. Um, Effectively, what they're saying is they are the reform we've been all waiting for 70 years. How's it going? What is this what's the article really about? It's about not about it's about changing the relationship we have with power, not our relationship with writing the right policy or creating models with statistical evidence. It's not that policies and statistical evidence can't be useful as tools, but they're not reform. The reform is about policy, is about power, and the power we're talking about is going back to Onda. Parents and grandparents are the agents of change in the lives of children, and governments should exist to help them be that. That's a power shift. It's saying whether you like it or not, parents and grandparents are those agents of change. How are we going to support them? How do we organize a democracy to support families as a central and critical element of a healthy democracy?
Yeah.
And I'm going to argue that that's something that's not just done at a national level, it's done at a county level.
No, absolutely. Yeah.
Your county will get there a lot sooner than this country will get there.
Yeah.
I guarantee you that.
I see Alice has her hand
Yeah.
up.
Yeah.
Thanks, Jeff.
Thank you, Townley. I'm sorry, I'm keeping my video off because my internet's not so good.
Sure. Yeah.
So I have a couple of questions in regards to what you're saying, having grown up in the foster care system myself, being a relative care provider. With the FFPSA that's coming out, allowing for prevention services dollars, how much of that, because I have also found that if more support services and income um, and care was given to the relative care providers, we'd probably have a lot more stepping up to the plate. And that's a real hard thing when we're looking at family findings and looking for the relatives, because in many cases, as relative care providers will tell you, are especially the children with extreme behavioral needs, violence and anger, breaking furniture, TVs, things like that, and we place kids, there is no replacement of services or um, furniture or TVs or any of that stuff. There is no um, respite to give these caregivers a break for long term. And I'm just wondering, how are you going to equate the monies coming in from the FFPSA monies and support that? Because with LA and all their special research, and actually it's been pretty interesting to watch that. Um, how do they get by when the federal laws are so strict and state laws are so strict as to what those monies can be spent on? When you have the insurance industry, uh, fighting for their little piece of the pie, you have, and I really agree with you on power. I think a lot of that is their best way. And I know as a tribal community, the evidence-based practices that they hand down from the exchange don't apply to our communities. And for instance, if we have to pick one of those 10 fidelity models, we're looking at motivational interviewing and doing it up and changing it, modifying it to meet our needs within our tribal community. And So making that happen when the others don't fit. So I'm wondering about the powers that be that are sitting there saying all these evidence-based practices are the key to success when they're not out there actually engaging with the communities that each affect, because every ethnic group is different and every
Well,
way of doing things is different.
yeah, well, thank you, Alice. So, and I appreciate your analysis. I think it's an important one. Um, look, you can find it because I make the mistake of writing these articles and then I have to live with what I wrote years later. And I was asked actually before Families First was passed by the imprint to write an article about what I thought about the FFF, about Families First, and I said that it was something that I basically said that it would fail. And I said it would fail because it was being sold as wholesale change when it was not wholesale change. Liz just put the article I wrote, you guys can read it, called "A Race to Child Protection Needs a Race to the Moon Mentality." And here's if just a little bit broadly for you guys just to know about where we're at with Families First is it's we that bill was passed 7 years ago. So
Right.
we're 7 years later. 7 years later, this country has spent, in all likelihood, well over $1 billion talking about it.
Hmm.
And we have, I can tell you, at 6 years after the passage of the bill, 6,900 children had gotten prevention services in the entire country.
Wow.
So let me explain. It was written by the industry and for the industry.
Hmm.
And
That's what I
what
thought.
it has funded are bureaucrats going to meetings. It has almost funded no prevention services for families to actually receive, firstly. And I realize but you can read about it because it's been written about quite a bit. And then finally, let's get to the evidence piece, which is what I heard you saying, Alice, reminded me of the way that we have to teach clinicians to use the DSM-5 TR, which is that we have to use it because it's how we claim Medi-Cal funding. But what we have to teach people to do is use the least harmful diagnosis we can find. So what your tribe, I think, is doing is saying we're going to pick motivational interviewing because it's the least harmful choice we have
Yeah.
and we'll make it work for us because it's the only way we can get the dollars. But here's the more hopeful part. Things have been moving really fast and there's so much going on. It is really hard to keep up. But I can tell you there is already a major change that California can take advantage of, but you're going to need, as tribes keeping in mind, sovereign tribes can directly take advantage of this. And then also the state can take advantage of it so that counties can take advantage of it. And that is that we now have a completed regulatory process that allows states and tribes to spend on kinship care dollar for dollar what they would have historically spent to take kids from their families and put them with strangers. So the 4E the 4E funding untapped entitlement monies can be used to fund and pay um, grandparents and aunties and uncles and others to care for children, including children with complex care needs, at the kind of rates that we've historically paid foster parents for,
Hmm.
instead of at a lower rate or a differentiated rate. We can use that money to help with housing costs. We can use that money to help with transportation. We can use that money to buy groceries, to buy furniture, to buy respite care. It's an untapped entitlement. It means there's no ceiling on how much claiming we can do under that program as long as the state has the match to meet the requirement. That happened this year. Um, we have now it's voluntary, but states can choose to use an entirely new set of approval standards for kinship care that are not the standards that we've used historically for foster parents. So, for example, if you take a toddler, you're forced at your tribe to remove a toddler, and you call grandma, and grandma says, "I'll take them." And grandma lives in a one-bedroom apartment, and she said, "I'll sleep on the couch, and Junior can have my room, and I'll set up a crib." Under foster care, you're out. Under the new regulations, we'll be there in an hour, and we'll bring a crib with us. That is a huge change. We are able to have standards that recognize the economic realities of kinship providers, especially kinship providers from tribes and African American families who've been disadvantaged in the society politically and economically. We have the ability now to use that money to support that kind of a system. So the federal policy, at least for the moment, is to support the states. What they said was make it as easy for states and tribes as possible to become a kin first system. And they put their money where their mouth is by changing the regulations and completing that process late last year and then announcing it in October in March of this year at the first ever kinship care convening in DC that happened to be at. So, by the way, some of the early implementors of these new rules have been tribes. The Suquamish tribe, for example, here in Washington, was at the convening, and they are using the new approval standards. They are doing the 4E claiming. They are using that money to fund tribal members to as kinship carers to care for their own. They've expanded their definition of kin beyond the state limitations. They can use a more expansive definition. California does that with their weird thing they call a nephrim, which is fine. Practically, it's useful, but has a weird name, is all I'm saying. Um, but we have the opportunities to do that. What I'm unclear about is what CDSS is doing about whether they're going to adopt the kin authorization standards and whether they're altering the state plan to do the claiming so that tribes and counties can access that 4E money to assist kinship carers equitably. But the
Thank you.
regulations now exist.
Thank you.
So you're welcome. Yeah. So hot off the press, we're talking about it probably before your state office is clear about what they're doing with it, which is not unusual. It usually takes a year or two for states to do that.
Something to look forward to then.
Yeah.
Thank you.
Yeah.
Thanks, Alex.
Hmm.
Um, I'm mindful of two things. One, I just happened to notice, Townley, in your original question, you used the word power. So I think we should head
We should
towards
talk
power
about that.
threat meeting. And I think some folks may need a bio break. So I think this is a good place to stop for a bio break so nobody misses anything. What do you think, Townley, Megan? 10 minutes? Is that too long? Not long enough? 10 minutes is okay? All right. So let's take 10 minutes.
So let me set this up so you know what you're coming back to. We've talked about, or I've talked about, the problems with the mental health design that we have. It would be unfair to not offer what we might do instead. And so when you come back, we're going to offer one of the 6 or 7 models that are under development in the world to replace the DSM with. So other countries have taken the advice of the UN and the WHO very seriously. And there are a number of efforts underway in the world to create a replacement structure for that. The one that we've attached to at this point, based on what we know so far, is called Power Threat Meaning Framework. And we're going to talk about that after the break.
Great, thank you. Okay, see you soon.
If you want to pause the recording, Megan, so there's not dead air for folks, you can, and I will help us. And Kevin has just put a quote in the chat. I just want to alert people to that in case you were still taking a break.
It's a little bit long, but that's from my piece on the so-called prevention services thing.
Yeah.
Well, so should we jump back in?
Yeah.
So just background, we're going to talk about something called Power Threat Meaning Framework, which is one of the frameworks under evaluation as a potential replacement for what the American mental health model that's based on the DSM design. And this is created in the UK by Lucy Johnstone and Mary Boyle, who are both psychologists. It's supported by the British Psychological Association. And to be clear, the Power Threat Meaning Framework is not designed as a therapy. It's not done as a therapy. It's not an assessment. It's not done to people. It's done by people. It can also be done by a group of people. It could even be done in an organizational context. And what it explores is is the relationship, firstly, the relationship between psychological distress and how power operates in people's lives. It is one of the uh, key bits of this that I think is critically important is it can be remarkably affirming for people who are in distress because it begins to um, in the narrative context, we might say, it begins to offer a fuller and thicker story of people's experiences. And that includes that while um, I may be experiencing um, other people's power in my life in ways that are unwelcome and are distressing to me. And I may be responding in ways in terms of my behavior toward others or toward myself that can be counterproductive to myself. The key first step is understanding that I always respond. You'll remember I shared David Dunbarow's 7 draft agreements during on the first day that we were together, where we looked at the 7 draft agreements and work, and one of them was that people always respond to oppression, um, and this particular work really gets into really exploring with people not just how power is operating in their life, but the fact is that they also have power and that they are responding to those things. Other people may not value or see as acceptable the way you respond and might call it bad behavior or something else, but it is a response and it is a response to something. And that something is not a disease, it's not a disorder, it's real. The big concepts that Liz and I are connecting to here is, that I talked a little bit about last week, was this concept of externalizing things. So what the big shift here is to stop putting problems in the bodies of people and calling it disease. Why is that an important difference? And Liz put in the chat earlier, she put a article. We put a number of them here. Hopefully you're saving them so you have a chance to look at them. But one is it's in the link. It says Kenneth Kendler, and it says implausible that psychiatric diagnoses are even approximately true. Kendler is one of the authors of the DSM, so it's important to recognize that one of the people who has been involved in the committee to develop DSM-3, DSM-4, and DSM-5, and then their derivatives, um, is writing in this article, which was published in JAMA, the Journal of the American Medical Association, just prior to the release of DSM-5 TR. He's getting out in front of that with an article and saying, look, the diagnoses in our book, but for a small number, and those that he's talking about are what are called organic disorders, like dementia, things that we actually can prove exist, are those diagnoses in that book are not even approximately true. But he goes on to offer his own opinion about the DSM, which he is an author of, that while it is not true, it's the only system we have, and therefore we should keep using it. Because that's his position in the article. I'll read another quote, by the way, to make the point, from another one of the DSM authors here. And this is something he said in 2013, so this would have been DSM, might have been 5, I'm not sure. I think 5 might have been around then. It says, in the future, we hope to be able to identify disorders using biological and genetic markers that provide precise diagnoses that can be delivered with complex reliability and validity. Yet, this promise, which we have anticipated since the 1970s, remains disappointingly distant. We've been telling patients for several decades that we're waiting for biomarkers. We're still waiting. Um, we unfortunately, during those 50 years, roughly 50 years now since DSM-3, we built an entire economic system in Medicaid, or what you call Medi-Cal, around and with health insurance companies as though these DSM diagnoses were in fact valid. So the problem we face is we continue to finance the mental health system and we use the DSM to do it, despite the fact that even the authors of the material would say these things actually aren't real. Now that's bad enough, but in the context of children, it has another problem or several other problems. One of them is that we have a court system that has also adopted these things as though they're real. And it relies on the testimony of therapists and psychologists and psychiatrists who give these diagnoses and treat them as though they're real and they have real consequences. So we will use as part of a negative inference against a person in a legal proceeding the diagnosis that they've been given, and then the opinion by the clinician about the consequences and the behaviors associated with that diagnosis and what it might mean as a way of explaining why it is that they are not appropriate to be in the life of a child. And for children directly, it can be used to take children out of a family-based setting and put them in an institutional setting because we have institutions that claim to treat these diagnoses as though they were real, and we continue to use even the STREPs, the or whatever you know what I'm talking about, the part of the Families First bill included the regulations around the ability to extend institutional placements of children if they met certain medical needs. It continues to treat these things as if they're real. So the problem is that we continue to operate this system even though its authors and the world bodies I mentioned, the WHO and the UN, recognize these are not valid diagnosis in the sense that they aren't things. They're descriptions of behaviors. The problem, finally, that we have is these descriptions of symptoms or behaviors that are and feelings that are described in the books. There's so much overlap between diagnoses that the evidence that we have, including an article that came out today in the UK by Joanna Moncrief, who's a psychiatrist, show that in children, that when they look at children who have been diagnosed with things like autism spectrum disorder, ADHD, for example, that there's no reliability available to prove that clinicians were able to differentiate between autism in one child and ADHD in another. There's such an overlapping in symptoms as to be meaningless, which is practically so. The problem for families and schools about this is they're relying on these things as though they are true and they're placing their hope in them as though they are true. And then they're seeking services from organizations and individuals who claim they are true. And then too often don't see improvements in children's presentations or adolescent presentations, which can lead to other consequences like leaving your family, um, or quite frankly, leaving parents or grandparents stuck, feeling like things are not getting better, even though they're investing a great deal of time and hope in these kinds of treatments and these kinds of appointments and other settings and taking just and distributing medications to kids and other things, but things aren't getting better and they're living with the hardship of a kid in distress and now they're a family in distress. So this is what we're concerned about as we it's not good enough to have a kin first system. The goal is to develop supports for families that actually are useful and help reduce suffering in people and again promote quite frankly, from a child development standpoint, reduce suffering enough that that suffering does not disrupt their development and ruin their health, not just their psychological health, but their physical health. Um, so, Liz, we have a slide of the framework, and then we can make it simpler.
Yeah.
Yeah.
Of course. I also have the graphic version of this if we want to
Maybe
go
we should
there.
do the graphic one. Yeah. Which, yeah, probably that one's the easiest, huh?
Yeah.
So I wonder, this is where if someone was be willing to volunteer, I know some of you thought about a person or family you were concerned about last week. If somebody has that person in their mind that'd be willing to unmute and join us, we could walk through how this might be useful. By the way, there are many YouTube videos on the Power Threat Meaning Framework that you can watch with John Stone and Boyle and others as a way to get more information. And also, there's a useful book. There's more than one, but the one I have is called The Power Threat Meaning Framework, an Alternative to Psychiatric Diagnosis by Mary Boyle and by Lucy Johnstone. Very simple, not thick, useful book for making sense of their thinking here. So do we have someone that has a young person or adult that you were thinking about last week who can join us? This would be very high level. Or we maybe Mary, or I'm sorry, Elizabeth, maybe would you be comfortable with looking simply at these and thinking about it from Morella's
Sure.
experience?
Yeah,
Okay,
absolutely.
let's do that.
Mhm.
So
You want some
Morella,
context? Yeah,
yeah,
okay, go
yeah,
ahead.
go ahead. You do it. You're the
I'll
clinician.
just I'll just do a short version. I know some of you are familiar with formulation also from
Last
the
week,
time
yeah,
before last, and maybe last time. I don't know if you touched on that at all.
we did.
I'm going to do the 60-second version just to remind us. So Morella identifies as female, so she uses she, her pronouns. She would identify her ethnicity or her race as Romanian, 16 years old. She is, when I meet her at 16, on her 20th placement in the American foster care system, but she's born actually in Eastern Europe, in Romania, where she spends the first 3 years of her life. She's in a hospital for 6 months, left there by her mother, and then in a Romanian orphanage, and then is adopted into the United States, and then subsequently diagnosed with a whole bunch of things at around age 3.5, including reactive attachment disorder, RAD. Some of you are familiar with RAD diagnosis, which was really popular for Eastern European orphanage kids during that time period, but I continue to see it sometimes. When I meet her, biggest worry is that she's going to successfully complete a suicide attempt. When I meet her, she's in a hospital setting. That's her current placement arrangement. She's been there for about 30 days following her last suicide attempt. They are escalating. Her ACE score is 8. She has absolute yes for developmental trauma. Lots of the social determinants, or as we call them, the political determinants of health, unsafe housing, economic instability, loss of parent, many of those. And the sort of big one that sometimes folks forget in terms of understanding adversity's level of loneliness for her, absolutely extremely lonely. And she's been like that her whole life. So I think sometimes when we think about loneliness, we think about what's happening right now. This has been happening to this kid her whole life, this sort of toxic stress and buildup and extreme loneliness. What's happening to her cells? What's happening to her health? What's happening to her body?
Yeah, so I just want to take a minute to use this to sort of bring up what we've already covered. The way that the what researchers call practice as usual unfolds. Liz, you can sort of comment since you were directly involved with her, is the way that we tell Morella's story from one practitioner to another is Morella is 16 years old in the hospital recovering from another suicide attempt. This is her 20th placement. She has had two failed adoptions, and she was from an orphanage. And the most important bit of information is she has reactive attachment disorder, tag you're it. And that sets a context then that has an expectation, which is everybody in the system knows what you're supposed to do when you get a kid like this. And the first thing you're supposed to do is complain that you got a kid like this because your life is about to get a lot worse.
Yeah.
Because your struggle is going to be, how do we keep Morella safe is going to be the big question. Or how do we keep Morella safe and stable in a placement becomes the big question. You see the problem with the use of the diagnosis of attachment disorder or depression or anxiety or all those things. And by the way, she's on a drug cocktail, which
Yes.
is what she uses to try to kill herself when she's not using um, razor blades to that she gets hold of. Many of us who've worked in mental health and worked in child protection, juvenile justice, know stories like this, probably except for the Romanian orphanage piece. Um, so that's the narrative that Elizabeth gets, and then Elizabeth is expected to just pick up and go on like everyone does with kids like this. The idea, quite frankly, unfortunately, in a sense, is to keep her alive until she's no longer our responsibility.
Mhm.
That's the mission. The mission is she doesn't die on our watch. With that's become the reality of practitioners with someone like her. So instead, I'm going to ask Elizabeth to work through these questions in power threat meaning from Marilla and her perspective and see where it might take us, how it might give us a wholly new narrative to respond to.
And before you do that, Kevin, I just had an interesting thought to your I'm still back thinking about Townley's earlier question.
Mhm.
Power threat meaning as an exercise in a group can be an alignment. What are
Yeah,
some truths we can agree on?
yeah,
How is power operating in Morella's life? I suspect even right now, all the folks here could come to some agreements about what's going on for Morella. Some things we know to be true at the macro or the micro level. What does that do to change the structure of how we make decisions, intervene, respond when everybody has the opportunity to do that? So just as a really practical example, there's simple alignment tools like 0 to 10 or A to Z, but there's also opportunity to align by mindfully positioning or doing power threat meaning or a bunch of other ones. So I just wanted to relate back to that
yeah.
town.
Well, I think it's a great question. So that first box you see in the upper left says impact of power on Morella's life. And the my reaction to that question, thinking about Morella's experience and other young people like her, is the only two places that, or there may, she, where you have to ask yourself what power remains hers, because there's almost none.
Yeah.
The only power remain that she controls is the power to what she puts in her body, I would argue. So what and how much food, fluids, um, whether she cheeks her pills and saves them up for a future attempt and hides them, whether she hides a razor blade she might have used or someone else has used to shave their legs and breaks the blade out of the and maybe hides it in her mouth so that it's not seen in her hands. Um, is there really, is she's, I guess, maybe when she sleeps or when she doesn't.
What
What
she
other power does she have?
what she eats and doesn't.
How she goes to the bathroom or whether she uses the bathroom at all for some kids. You can see that the power arrangement she exists in, which has effectively been unseen until you ask this question, is she's almost no power at all.
Yeah.
Is what comes up in that first. The impact of power is she ultimately holds a single power, whether she lives or she dies.
And I think to your to that point, Kevin, the impact of that is, and this would be true for Morella from my perspective, but also lots of young people, parents, other people you might think through this with. The impact of that is that the things we see happening, the behavior, the response, all these things we're going to go through tend to be categorized as sort of lower base, instinctual, responsive, reactive, problematic, labeled behaviors by our systems, right? So a teenager who's deciding whether or not to use the toilet at all gets viewed a particular way outside of this context if you don't have this context, right? So,
Yeah.
oh my gosh, I can't believe this kid is doing that again. What's going on? If they could just behave, they could probably stick it out in this foster home versus, hang on, let's think about what access to power this person has. And this may be it. So if you have only one way to communicate, how are you going to communicate? And then what changes are we trying to maintain? I'm kind of picking on a foster care setting here, but are we trying to maintain that this could work if only, or are we trying to understand what it would be like for this kid's health and development if they had a little more access to age appropriate power structure in their life?
Yeah.
Very different conversation. Developmental catch up is what comes to mind for me.
What would you say are at 16? Keep in mind, this story changes over time. She's growing older, more aware, more complex in her ability to think about things and feel things. So this is an evolving, developing response. What are the core threats she's responding to, do you think, Liz?
I think the core threats she's responding to are there's no point in being alive.
There's nothing to look forward to.
There's nothing to look forward to. No one cares.
There's nothing to look back to.
Yeah. I think she said to me once, it was like living in a vacuum
Hmm.
or a black hole. I mean, some of you have seen her drawing of her life
Yeah.
at that point. She's down at the bottom of a hole, right? A black, dark hole. There's nothing. I don't exist.
There's no
I don't exist
context for
myself.
existence.
Yeah.
It's
Yeah.
not about her context for existence. Remember, the mission is she doesn't die on our watch. That's not about her. That's about a system.
Yeah.
Um, Meaning, and you can see what happens as you start to talk about these things. They lead right to the next thing, meaning and discourses. How does Morella make meaning out of this power experience and the way she observes the threats to her?
It doesn't matter if I live or die. And so I'm going to do my best to execute on not living, on dying, including I have to mention that Kevin knows this story, but many of you won't. This sometimes when we do power threat meaning, and we've never done this with Marilla, so I'm just thinking as I talk here, but sometimes the instinct is to situate just in her, but I want to acknowledge something about it doesn't matter whether I live or die. We also get that message through our experiences or lack of relationships or lack of connection or sometimes very direct communication. In this particular example, she had a judge
Mhm.
during a permanency review hearing say very directly to her, you are going to end up in jail or dead. I'm just trying to get you through this review hearing. So that's not something that's made up in her head. It's something she receives from a position of power and authority in a very different way, and then internalizes subsequently. Because where else is that supposed to go? I didn't
And
hold that.
I
Her
think
social worker didn't hold that.
I think she had a group home staff member say something similar, didn't they?
Yes, I believe she had some version of that communication multiple times.
Yeah,
Yeah.
in different settings.
Yeah.
Um, just for fun, let's go to what made things better or worse.
So she would say, what made things better? What made things better were opportunities she found to connect with other people who had also survived Romanian orphanages. She had two friends. It was not uncommon in this particular group home in Pennsylvania. Somehow those kids found their way there. It was a sort of treatment facility for that kind of trauma. And so she had two friends. She was forbid from talking to those friends as a teenager, and she did it anyway. And she would say that made it better, just
And
to
what made
have other people. What
what
made
made
things worse, being restricted from doing the basic things she knew to do to take care of herself, being restricted from having any even opportunity to imagine what might make things better, and having that dictated to her. And I think the other big one that sticks out for me, this is probably with a lot of bias because I was one of her social workers, but what made things work, having a parade of professional people in and out of her life.
she had more than
She
50. That's right. She had more than 50.
more than 50, we counted, yeah.
Yeah, more than 50.
And just to connect back to, what is the sort of, how does power operate in your life is the question sometimes that gets asked, or what happened and how did you respond to it? You mentioned, Kevin, the cheeking of pills or the razor blades, or if some kids, using the bathroom, or, whatever it is. One of her, I think, brilliant superpowers was when she would first meet a new professional person, she had some choice words for them, usually,
Mhm.
as a beautiful protective mechanism of, here we go again, another person. I know exactly what to say so that this person never comes back.
Mhm.
I mean, I don't know if I've ever shared that story with this particular group, but when I first met her, I came in and said, "Oh, we're going to do family finding. It's going to be amazing." She said, "Go fuck yourself."
Mhm.
Okay.
With an attitude.
Oh, yes. But she still has that, but
Yeah, she
the
does.
language has changed.
Yeah. So superpower she
Yeah.
has.
It's
The next
incredibly
question,
protective.
just because I'm curious about bodily reactions and threat responses and their functions.
Mhm.
What are the bodily reactions she experienced?
Cutting into her own skin to feel is what she would say. I was always waiting for her to finish the sentence. That was the end of the sentence. I cut to feel.
Yeah.
The end. Um,
About
eating,
her, yeah, I was going to say eating. Yeah, go ahead.
her weight was pretty out of control when she was that age. Now I have to acknowledge that she was on this medication cocktail, which also caused horrible weight gain and hormonal
Yeah,
imbalance for a developing brain and body.
yeah.
Um, Cutting her hair off.
Um, I'm going to guess metabolic problems,
Yep, metabolic
probably
problems.
pre-diabetes. Yeah.
Yes, I don't know. I don't know if that was ever in her history, but certainly wouldn't. I mean, it wouldn't shock.
Unfortunately, the healthcare experience of those kids is so neglected that
Yeah.
they wouldn't have done a basic test to find out they were paid attention to it.
Yeah.
Yeah. I just remember seeing her at 16, and my best guess would have been that she, again, probably as much as anything related to the drug cocktail, that we know that their risperidol and other drugs had strong side effects with metabolic syndromes. Yeah.
The other bodily sort of reaction and its function that I think about all the time, only because I have a side by side of this. I have a picture of her and I as we were doing some detective work together in the first months of our work, and a picture of her a year and a half later. And her how she holds her bones is different. She's very curled up, her head is down, she kind of looks at you like this because she's literally protecting her own organs.
She's oppressed. I mean, it's a great way to physically describe what oppression looks like in the body.
Yeah. Versus, I say to her sometimes when we talk about this part of our time knowing each other, she got taller. She didn't grow, but she got taller. Why? Because at some point she didn't need to hold that anymore, right? She was able to kind of sit up straight. She literally got taller.
Yeah. And how about strength and power resources that she had?
Friends,
Mhm.
incredible ability to, as she would call it, phase through walls or walk through solid objects. In other words, an expert at navigating the many barriers that she would say existed in the system and in her treatment from the system or the people who work in the system. Incredible communication skills. And, this one's kind of particular to the unique part of her story, maybe about being from Romania, but really incredible detective skills.
Which she developed with your help.
Yeah, 16 years of trying to build a story in your head creates some really good skill for thinking about what questions you might ask to confirm that story.
And just note what Liz is saying, talking about here is Morella and Elizabeth. Um, the one thing Morella, what Elizabeth did in her work with Morella was change the way power operates in Morella's life by asking a very common question that people ask, but actually meaning it, which is, Morella, what do you need? What do you want to do? And Morella had said effectively, I want to know about my background from being from Romania. I thought I'd been told that I was from an orphanage, and I assume I have a family there, and I want to find them. Um, and the two of them, how long did it take you guys to do that?
8 months.
8 months. They find that she's in the middle of a sibling group of 11. All 11 dropped in a different orphanage. They find each of them. And then they find her mother who dropped those kids. And then they finds out that they all have the same father, and they find him in Italy. And I always tease about being an old guy in my TV references, but I always say about the two of them, they're the Cagney and Lacey of family finding. They become this powerful detective duo, and they unfold this international mystery going back almost 2 decades. And that process of being empowered, I would argue, Liz, even on all the uncertain days when you weren't finding people, when it wasn't happening easily, but she's engaged in the process, and it's a process that she said was my process. This is the first time in her life where she gets to have a process that's meaningful to her and is about what she believes she needs to exist in the world. And she's actually being supported to do that thing. Liz was not being supported to doing that thing, by the way. You were being told to stop.
Yes. Yeah. Which gets into the sort of structural part of power threat meaning, right? We could easily be doing this around the experiences that each of you have in your roles or in some of the functionality of the financials of our particular system or the many others that collide with it. I was thinking, as you said, that one of the power resources that's interesting to consider for her in our time doing the work together, she's still in my life, so I always reference the two parts of our life, is there's really interesting research about economic insecurity. For example, Robert Sapolsky talks about this a lot. It's not being poor, he says, it's feeling poor. It's the experience, right? The dynamic you have of feeling that inequality, right? Of having the experience of everyday racism, of feeling it. The opposite is also true. It wasn't that we found people, although I think that was significant for her. It was the feeling that she had a right to, that she had some power in the process to define her own life, to discover who she is, for better or worse. We didn't know what we were going to find. That wasn't the point. It was that she had a right to do it and people to come along with her as she did it. Feeling supported, not just being supported, feeling loved, feeling, okay, I understand where I come from in Romania, not just doing it, the feeling of that.
Yeah, important to mention, I think a critical part of her recovery was not just finding her mother, but talking with her mother, with a translator,
Yep.
and not just having her own narrative for why did my mom leave me in the hospital to have all these horrible things happen to me, but what does mom say about why she left me in the hospital, and what about my brothers and sisters? And you want to say anything about that?
Yeah, maybe just to say, I mentioned she spent 16 years building the story, right? All of you have met young people like that and parents like that and families like that, including in my own family. In many of yours, I suspect this is also true. I have my version of the story of our family, and someone else has a very different one that's not abnormal. I think the powerful part of that for her was when she spoke to her mother, she had a story about herself. She was given away. You heard it also in the video, those of you who were there last week, from Dr. Gregory Smith. My mother gave me away.
And
My
he
mother
also
gave
said,
me
because
away.
we just watched this, and I could never forgive her.
Yeah, right. So
He
that's
did
his,
say that.
right?
By the
Morella.
way,
Yeah, go ahead.
just I was going to ask you because we talk, we talked to Dr. Smith. We're actually working on a writing project with him. And what does he now say about, you heard him, you guys, you heard him in the video say, I could never forgive her. Now he says about his parents at age 70,
Yeah. I've forgiven them and I carry them with me.
they're with me everywhere I go every day, and I love them.
Both parents.
He, not a therapist's narrative, his narrative, how his narrative grows and changes. Does does that matter for us to tell you because it goes in a direction that we like? It could have been the other way. He could have been saying at the time they go with me everywhere, and by age 70 he could have been saying I can never forgive them. It's not about us liking the narrative. It's about him making meaning over his own life, which he had been entirely denied any we sometimes call it authoring, being an author and architect of your own life. That seems to be at the heart of this narrative, be an author and architect. So you're looking at someone like Morella, who you meet in the condition that she was in at the time, and you're thinking what's missing is this ability to be the architect that you are made to be seen, not just how do I want to say this? We talk about power all the time in a rights-based context. There's a difference between talking about people's power and the doing of people's power in your practice. And Liz is coming up beside her and unlocking Morella's ability to do with her power what she must do. Dr. Smith does what he must do with his power. It takes, as our friend Father Boyle would say, and it takes what it takes. But you don't get to any of these things if you buy into this flat narrative of kid with an attachment disorder, suicidal, self-harming. These are not descriptions of a person being who they want to be in the world. They're descriptions that outsiders use to talk about your role in their life. I work with suicidal kids. I work with people that self-harm. I work with kids in institutions. I work with broken families. That has nothing to do with families. It has to do with you or at you as a therapist or whatever or social worker. It's how you it's where you will find yourself standing in your practice and how you then use your power in that practice.
It's a different way to see, I think, for us in professional roles, but also for people, right? In Morella's example, if she were sitting here doing power, I mean, we've done some version of this, I guess, her whole life now, but um it's also how you see yourself, right? She would have said the story about her family was she was given away, but the story about herself is I'm worthless. There's no point in living. I have reactive attachment. I'm never going to have a relation, right? All those narratives versus this power threat meaning narrative gives people a very different view of their own story and their power over their own story, right? You're the author, you're the architect, as Kevin said. And I think the initial conversation with her mom, I think was shocking. It was a shock to her system because it was such a different narrative. Her mother said when she heard Morella's voice, she said in Romanian and then was translated as, "Oh my God, you made it to America, the land of golden roads." For her mother, the story was she made it. She's okay. And really interesting use of power in Morella's moment. Morella never told her mother all the things that happened to her here. She immediately said, "Oh, my mom thinks I made it. I'm gonna make it. I'm gonna fill that narrative. I'm gonna become that. What would that be like?" That's what was important to her. And I had someone ask me the other day, Kevin, what if you'd never found her mother? That would be hard, but I don't think that was the work for her. It was being able to do it. All the things she uncovered about other people who had had similar experiences.
That's where her connection to the
Mhm.
or her she was already doing it on her own, but her connection to other Romanian orphans would have been useful because she would not have been alone in not knowing who her parents were. She would have been in a community of people, as we see with Korean adoptees, we see with Chinese adoptees who continue to live without, and domestic adoptions too, where people are forced to live without knowing, not without finding people and being and so you get into community by seeing how other people live without finding people. How do you do it? How do you feel about it? That she was already finding that for herself before Liz even met her.
Yeah.
Yeah. I should say, I think also to contextualize what Liz said about she learns from her mom is about you're in the land of golden streets. You're the only one of my children who made it. In other words, all of the other 10 who were in different orphanages didn't get there. They are now either still in orphanages or they're living outside of orphanages, post-orphanage, and they're living in an Eastern European society that's incredibly unequal and where life is great, grindingly difficult. And her mom had a plan for her kids, which was from orphanage to adoption. She could not provide for them. That wasn't a failure in her mother. That was a failure in the society, in the way the society and the politics of society failed her mother. She was doing what she could do as a mother to try to save her children and give them something she could not, which is survival.
Mhm.
Morella turns out to be the success story from her viewpoint, not the failure. And Morella learning this has to integrate that perspective into her own narrative about whether she wants to live or whether she wants to die. Um, she just this year, not because it needs to be this, is just something we value in our society. But I also think when it happened, it made me think of Morella's mother, and her mother passed away a few years ago. Um,
Today.
but but I'm sorry, what, Liz?
Today. This is the
Oh,
anniversary.
this is the anniversary of her mother's passing today. But Morella graduated with a graduate degree this year, and is in a is she married?
She's engaged. She'll be
She's
married
engaged.
next
She's
year.
now a homeowner. She works with kids in institutions to help them save their own lives when the system won't. Um, Her mother, she, you know, I'm certain her mother, if she understood her situation, would be deeply proud of her daughter. And I think her siblings are deeply proud to be
Yeah.
her sibling.
Mhm.
So what's more true? A kid with an attachment disorder you need to keep alive, or a superhero? And I remember I asked Elizabeth this a couple years ago. Morella's now 30, by the way. About to be, when's her birthday? She's 31.
Tomorrow. Tomorrow she'll
Tomorrow.
turn 31.
Oh, her birthday's tomorrow. But I asked Liz years later to ask Morella what her superpower was. Liz mentioned to you what it was. Morella said, "Oh, that's easy. I have the ability to phase, which is the ability to rearrange my molecules and go through any barrier." And my big question for Elizabeth when she heard that from Morella is how would it have felt at the time you were working with Morella in that first year if you'd known you were working with a superhero?
It wouldn't have taken nearly as long and it would have been a lot easier for me.
That's right. It's a pen. If she had bought into the narrative that Morella was a superhero rather than an attachment disordered, abandoned, 3 times abandoned Romanian orphan, which was more true, which holds more hope. And the question is, what kind of job do you want to do every day? Um, we find in our work in family finding and what we now call family seeing that most of the changing isn't about changing other people, it's about changing yourself, about rethinking your relationships and where you fit in the world.
I hope this isn't too meta for us, but I wonder, Kevin, if you'd say something about futurity, indigenous futurity here.
Yeah. So Liz and I did, I don't know if you have that recording we could put in
I
for
do.
them. Good.
Yeah.
So Liz and I are fellows with the Royal Society of the Arts, which is a 300-year-old British organization, and we are members of the American branch of it. And we were privileged this year to host what they call a salon, and we invited two colleagues to share that opportunity with us, and really just to foreground their sharing. One is Sheldon Spotted Elk. And Sheldon is a member of the Cheyenne Nation, and he's also a lawyer, among other things, and a father. And he shared a beautiful example of indigenous practice that we thought was powerful called indigenous futurity. And it's a concept where first peoples in this country are taking control of their own narratives as sovereign nations and sovereign people and they use things like poetry, physical arts, science fiction sometimes, and they use those constructs to invent their collective futures as a sovereign nation. They refuse to be defined as doing better than other tribes or doing in a particular way that's valued by the American government. They will put their own stake in the ground. They will, um, they're sort of like the Cheyenne dog soldiers, where they put a stake in the ground and are the rear guard. They fiercely own their own process for deciding what a good future for the Cheyenne Nation and Cheyenne people is. And it's called indigenous futurity. And we think it was a profoundly powerful concept that you can listen to Sheldon talk about in this salon with the Royal Society of Arts. We also had why do I block in her name, Liz?
Angela Burton.
Angela Burton is a African American lawyer an abolitionist from New York City who's a profoundly influential, powerful thinker and doer. And we also have an opportunity to hear her talk about a very so the setting for this conversation was not to talk about the and be critical of the systems we have. It was to focus our conversation on what would we build instead. And Angela speaking about what African American families and communities have built instead and are living instead. And Sheldon is talking about what he sees in his work around Indian child welfare in the country and outside the country about sovereign nations um, living instead their inventing of life and inventing of culture and society and governance instead of being defined in response to colonization. So beautiful work by both of them that we were pleased to stand with them and as they shared.
And I think it maybe just connects the dots a little bit for, I'm just thinking about us all being together today and last week and again in January, and as much as y'all like beyond that, of one of the sort of ping pong moments of these types of conversations in this work is, here's the big thinking, and what are we doing about economic inequality, and what are we doing about systemic racism and how that's played out over the last, I don't know, 1,000 years or so, but we'll call it 350 for at least our country. And that's all really important. And what does that mean for this parent right now? What does this mean for the 16-year-old right now? and how do I apply that? How do I translate that? How do I stand where I can do the most possible good? I just think it's good to be able to ping pong back and forth between those two, or maybe more fluidly for some of us, depends on where you're at in that process. I'm mindful, Kevin, that there's one question that I didn't ask at the beginning, but maybe it helps us close the loop, at least for today. The question was, I'm not going to read it verbatim because I've not got it on my screen, but the question was essentially, how do we make sense of all this in the context of navigating that we are sometimes working with families where there's a person who's just wonderful and makes sense and kin first and all those things, and living with someone who's not appropriate, using substance, mentally unwell, has a history of some sort of conviction. It's right. What do you do to navigate these systemic structures that exist that make that problematic, whilst knowing that this grandparent who lives in that house might be the answer to health building for this young person I'm working with? So
I don't know that there's a definitive answer. I'm going to give you my strong reaction as I listen to you share that. I must be really, I'm going to be unkind a little bit. I apologize, but I do it to make a point, which is it must be lovely that you encountered someone in that family who's like you and you feel good about. Do you get the point I'm making? You're connecting to the wrong person. That it's not, you be careful when you work with families if you're drawn to the people that are like you or there's something about them that makes you feel really comfortable and it allows you to to kind of affirm your discomfort with the person who's been identified as the problem in the family. I don't think we're called to the person who we like to hang out with. I think we're called to learn how to like to hang out with the person we're called to hang out with, which is Morella. When Morella told you, I apologize for the swear word, but I'm quoting her when she said, fuck you. A lot of people said, okay, and left. Elizabeth said, oh, I'm really interested. I'm not going anywhere. But what I think I learned from that is if I say I'm going to do something, I better do it. I better learn how to be trustworthy with this person. This person's telling me something. Everyone else has been untrustworthy. I need someone to begin with who I can trust. So become the trust is not a word. The trust is a behavior. You showed up the next week and the week after and the week after and I think you probably I don't know what she knew about the pressure you were feeling to leave her to abandon her. Probably I know you well enough to know you wouldn't have told her. But I think she probably had a sense that it wasn't always easy for you because you were under pressure. The system was just stop doing that with her. You're wasting your time. Just let her be the patient. Let her be everything we've said she is. Wouldn't that be easier for all of us? It might be easier for all of us, but it isn't what she needed. And it's not what Elizabeth needed as a practitioner. So I'm going to say, if you're feeling really pulled towards somebody who's an example of the values you hold in that narrative and being, that's lovely. I'm sure they're wonderful to spend some time with, but I'm not nearly as interested in that person as I am in the person who's struggling, the person who, particularly when it comes to parents. Uh, you know, Father Boyle wrote a book called Radical Kinship, and the notion of radical kinship was not it's not about showing up with people and trying to change them. It's allowing yourself to be changed by them. So how can I be reached by this parent? Am I willing to be changed by my relationship with this parent by seeing things I don't want to see, seeing things I don't understand? I think that's challenging, but I think that's what I think I would do. That's what I'm suggesting that we do.
I think the other piece I'd add, at the risk of calling out a particular elephant in the room, is the subtext of the question for me has a word in it. The word would be safety, which comes up on occasion in our work, maybe more than it should, which is my bias, but physical safety is number one. What about relational safety? What about cultural safety? What about emotional safety? What about connective safety? All those things. But if I'm, and forgive me for the person who asked the question if I'm misrepresenting the question, but the other thing that comes to mind for me is for the person you are connected to and their beautiful way of seeing the world and committing to the health and life building of the child in their life, whatever their role is, whatever their relationship is. Shouldn't they be a part of the conversation about how everybody in this family can safely love this child, right? Morella never went to live with her mother. Dr. Smith was the patient in effect, but what if he had been a network member to engage instead? Would we have supported him so easily? Would we have engaged him so wisely? Maybe not, right? Kevin asked him this once, who is Greg Smith? And he said, well, Greg Smith is the past and Dr. Gregory Peel Smith is now. And it's both things. I did set an apartment building on fire. I did believe for a long time I was a sociopath. I was a hermit who lived in the rainforest. And I am a tenured, beloved professor at Southern Cross. I am the head of the homeless commission for half of Australia at this point. I am a dad, a husband, a friend, a community member. It's both things. And so in the context of the question about like, ooh, how do we navigate that? I sometimes think navigating it in terms of where a child lives is different than navigating it in terms of the conversation about how we might all love this child.
Yeah, I need to add because there's a risk that we, through the way we tell this story today, that we um, suggest in the narrative um, more responsibility for you than, in fact, we believe in. The I mentioned last week, and I want to mention again, what we do in our coaching is actually um, really think that there are some particular boundaries that are important in actually being of use to people, being a useful bystander. Our friend Cormac would say, and that is that there's only three things that we think we can be when we work in a community or with a family that is not our family or our community or our tribe. We can be a catalyst. We could be a convener. We might be a facilitator. Those are the three things we can be, and it's all we seek to be. And what that means is that if I, well, in our personal work, learning to see and be curious about and seek a relationship with the person who's least like you rather than one most like you is probably a useful personal practice. My work around that might be used to catalyze that kind of thinking in a family meeting or at a child and family team meeting. Sometimes it's the family that's rejecting a person in distress. Sometimes they are not navigating the relationship well. A quick story, another reference we could put in the chat. I did a project in Manitoba in 2016 to 2018, about 175 First Nations children and some Métis children living in kind of marooned in a crisis system, which meant they were placed into crisis foster care placements as infants typically. And then now some of them had been in those same crisis settings for 16 years. They didn't know they were Indigenous, or if they had been told they were Indigenous, they had no way of making sense of their Indigenous experience because they were instead culturally, their cultural experience was taking on the culture of their foster parents, not their First Nations community. And many of their foster parents were Filipino. They had been given special visas to come to Canada. They would be given the opportunity to come to Canada with a visa if they traded that for becoming foster parents because the province couldn't recruit foster homes. So these kids, some of these kids grew up and their first language was Tagalog and they were culturally Filipino, but they were in fact Cree by birth and by culture and by language. And they were now 15 and 16-year-olds and 12-year-olds and 10-year-olds. The long story short is 76% of these kids through the 2 years that I led the project left the care system and went back to their indigenous communities through work that the young person and their parents and their grandparents and others, including elders from their First Nation, did together. What was that work? That work was not centered on getting these kids out of foster care. It was about us trying something different. And that different thing was the ministry through the practitioners that I was coaching, inviting, if families wanted to do this, inviting them to come to the table, um, but to do it differently. And the difference was come to the table in the ways you feel are important to talk about what happened in your family. The particular people that we were thinking about were not the children in the emergency placements, they were their parents. And the story of most of their parents was they were from First Nations communities, usually remote fly in communities in the far north, who, for somehow, whether being removed by child welfare or later um, as young adults, they made their way to Winnipeg to be in the big city. And while they were in the big city, whether it was because they aged out of the care system there or whether they found their way there, uh, life had gone poorly for them. They had developed addictions. They were very unwell psychologically, and they were often homeless. And some of them had died, by the way. And um, and so the conversation in the family was a much bigger conversation than having a child in the foster care system. It was, what do we think has happened in our family? Why do we think these things have happened? And the critical component is, as a family and community, what might we want to do about that? And that then leads ultimately to the thing that you'd expect it would lead to, which is at some point in that process, as a facilitator, we're going to raise the question, yes, and what about the children? Yes, and what about the children? Where are the children? Who's caring for the children? Are they home? Are they somewhere else? How are they doing? What do you think? But the work was more than making a narrative about what's happened as we might do today in a power threat meaning framework, as a family and a community, but it was, what would it take for healing to happen in our family? What would it take for healing to happen in our first, between us, our family and our First Nation? And ultimately, what would reconciliation look like between us and the dominant culture government who took our kids? And they spent about usually a year meeting once a month as a larger family. Because they were remote and fly in, the ministry paid the costs of flying them and accommodating them in Winnipeg, where the children were and where the parents often were if they were still living. And they would spend several days working and spending time together. And often, one of the things I really admired about these folks is some of them would go out on the street and look for the parents. They would go find them at a homeless shelter, find them on a corner in a neighborhood where they were known to frequent. They would bring them blankets, they would bring them food, they would bring love to them, they would bring welcome to them. They would invite them into the process. They might be told to go away, and then they would come back again and again and again and again. And they did their work as a family. We were conveners of this process. We were a catalyst for this process. We might be a facilitator for this process, but it was their work, not our work. And the end of it is 76%, as you'll see in the link, if you read the link there, 76% of those kids had a plan. By the way, 30% of the total who got a plan, the plan was they stayed with their foster parents because the the foster parents were at the table also, and so were the young people. And from the young, and we had the families came to the realization that they had to view their children's experience by putting themselves in the shoes of their children, which is, this is the only family I've ever known. My first language is Tagalog. I am culturally Filipino. I don't know how to make sense of you people. I don't want to be there. And there's nothing right about that. There was nothing right. That's not a solution. It's just what is. And the responsibility for that happening belonged to the government for breaking apart these families and for recruiting foster parents from by giving them a tantalizing visa and producing this result, even though it was an unjust result. The government couldn't fix that. Reconciliation simply meant that people would come together with the young person and make the best decisions they could make as a result of what had happened. But wasn't that more just than a caseworker somewhere making that decision and a judge? Because a therapist diagnosed the kid with something. You see the difference. Um, the, the, you know, we're doing our best with Manitoba to keep working on these ideas. We'll see how it goes. Yeah.
I'm mindful that we're nearing the end of our lovely time with y'all, at least for today. We are going to get back together January 3rd. Is that right, Megan? January 3rd. So in 2025, that's exciting. And I just thought I might offer to folks, because I kind of have alluded to this several times, but I'm gonna, at the risk of being repetitive, say it again. The best thing most of us can do in the context of these conversations is go try it, go put things into action. In the context of the work that you do and how you want to be seen in the world and your work in the world. And so in the context of today and last week, I might suggest some homework, as Megan would call it. Or actually, it's not homework, it's work, because it's stuff you should do when you're at work, not when you're at home. Right? All those good boundaries we talk about. So I might suggest for us, as a way to kick off January 3rd, that we welcome some more questions. So if there's a mechanism for you to submit them to Megan or Townley, fantastic. And if not, to us is also fine. We can collectively gather. Take a shot at maybe trying some alignment work or some power threat meaning work with some folks you're working with. If you're feeling really powerful, how about a couple network meetings with some of those folks, and working through some of the things we've learned together the last couple of months. And if it's helpful, we send out lots of resources in the chat. Some of you probably have saved them. If you didn't, don't worry, because I'm going to send them all again. I'll make sure that you have library and PDF slides of kind of a guidance system, if you will, for some of these, so that you can try them, you can practice them. And I always say this about the tools that or the participatory methods that we use the most. When you try them, make them yours. Ask the questions the way that you would. Go for a walk while you're doing it. Draw it on a big piece of paper. Sing it. Whatever. Some of my most favorite examples of tool use, particularly bridges, was totally redesigned by young people in a young person's support group of sorts that started in the UK. We got to hang with some of those folks, including a young man who decided his action during the workshop with other young people was going to be to go see a friend he hadn't seen in many years. And he was really worried about if he was going to be there or not. Well, his friend was there. And what did he do with his friend? They did bridges, which is a tool we teach sometimes.
Yeah. Let me just say about that, just a very simple construct, imagining any sort of bridge that you'd like to. And today you're on this side of the bridge, and at some point the goal is to cross it. But imagine also that you have a backpack that you're carrying. And the first question we want you to ask is, what are you carrying in the backpack? And how useful is it? What do you want to take across the bridge? What would you like to put down? There's another fun question. Are some of the things in the backpack things you didn't put in there? Things that you're carrying because you're in a system to put them in there?
Mm-hmm.
And do you want to keep carrying them? Oh, so what is, and then of course you can begin to imagine what you're looking to on the other side, where that bridge would take you. So we're just different, what we call participatory methods with people to apply narrative to our process rather than casework as usual or industry as usual kind of thinking. Just again, what we find in our practice is that um, our learning process is more about changing ourselves. It isn't about changing other people. You're not, as Father Voyle would say, you're not some kind of delivery system. You're catalyzing a process. You're convening a process. You're possibly facilitating a process. So, Megan, for your organization, at a community level, catalyzing, convening, facilitating. You're not the change, but you can catalyze and convene people in their process of change.
So I think it would be great to start our next time hearing from folks, right? We're happy to talk with you for 30 or 40 hours in a row. But with would be the operative word there. So I'd love to just welcome some folks into the conversation when we kick off on the 3rd, and what you're thinking about, the questions that are continuing to come up or coming up for the first time, and how it's going, what you've worked at, and how you've made meaning and made sense of all of this, as we continue to work it through together. So looking forward to seeing you in 2025, and big thanks from me, and I'm sure Kevin as well.
Thank you. Yeah, thank you very much. Good to see
Yeah,
you
and
again.
I just wanted to, yeah, I love what you just said, Liz, and I think that's what I hope everybody comes on the 3rd with a question about what was presented, a question about implementation, maybe a lingering question about a concern. And then maybe that's where we can really start to make the changes happen, is in that process of figuring out those details. This has been so amazing. I just really appreciate both of you so much for your time, your preparation. I have all the links open that you put in the chat on my computer. I'm happy to also send those out, but if you've got them in handy one place, that's great too. Maybe both of us can send them out as just double up the work there. But thank you all. And if anybody has any questions that you'd like to submit anonymously, for whatever reason, there's that survey link that I sent last week for the Q&A that I did download those and gave them to Liz and Kevin. So you can use that process, or you can email me if you prefer that way. So I think that's all we've got, unless anybody has anything they'd like to add. But just a huge thank you to both of you.
Likewise, thank you
Thank
all
you.
for being with us. Have a great rest of the day and rest of the year.
Yeah. Thank you.
All right. Thank you.